Amanda. You're very cute. Is it like springtime, like summer, winter?
You know exactly what month and what day.
Oh yeah, it's March 5th, right?
Correct.
Okay.
You know why you're here?
Wait, where am I? Oh yeah, I'm at the hospital.
You know what hospital?
St. Joe's.
That's correct. And you know why you're here? The purpose?
I think I got a knee replacement, right?
Yes, that's
Yeah.
correct. Awesome. So then, I'll begin by checking her eyes.
Yeah, I'll be still. It'll be easier.
By checking her eyes, that they dilate, and then do one more time, look at this one. Do one more time, look at this one. And then if you can look at the tip with my finger. And then after I pull it down, just look straight ahead, okay? Okay, that's good. So then look at your, if you lift your head, start to look at using your nostril, and around the ear. So I noticed that you were wearing a nasal cannula, so I'm going to check the back to make sure that her ears don't have any kind of skin breakdown back there as well. And then if you open your mouth, okay, so you drink a lot of fluids, I see. Okay. So another thing, I'm going to have to pinch your chest to see if you're well hydrated. Is that okay?
Ouch!
Awesome, sorry.
I'm just messing with you.
So then, if you could put your hands up and close your eyes. Okay, that's good. If you keep them up, then push against it. And push down. And if you could, do you feel that? So now, I'm going to be checking your pulses.
Okay.
Make sure that they're there.
Why are you squeezing so hard?
I'm not. And then I'm going to be checking your cap to make sure that you have good oxygenation. And then if you could do this as well. Another way is if you come in the morning, you get to the patient to this robe or unbutton a couple of buttons. Shows the same thing. And then after that, I would clean my stethoscope and begin in the heart or the lungs. So usually for me, I go on this side and I listen there for a whole minute. And then after that, for the lungs, I go in here.
But you fan out.
Yeah, fan out towards the side. It's kind of difficult me doing it for women, but it takes practice. You gotta do it. And then for the back, of course, you want to go inside the bones, come in and out.
Hourglass.
After I do that, she's breathing real well. She's an athlete, so she has a really good heart. And usually, you would want to tell that to the patient right after you listen. Sometimes they get worried, like, oh, what do you
Why'd you listen for so long?
Yeah.
You know, everything sounds good, you know. Everything's normal.
So then you would go down to the GI and listen at the bottom, over here, on this side, and on this side. And then you would palpate as well. If you have any pain, ask them for bowel movements. If they have any other pain, if it has pain and stuff around there. Check if it's distended or if it's hard. So then after that, I put my stethoscope in my pocket. And then I would tell her that I would need to see her perineal area and the back. So just pinch your side a little bit. Okay, that's fine. And then the other thing, put on my gloves. Now I go down to her feet. And then make sure that if you could push up to your nose.
Yes.
And down. And then check for edema. So you're good. Check the pulses. And then lift your leg, of course. And then push back for the homing sign on each leg. And the other thing is, if they're walking around or they're going to the bathroom, you want to do the gross motor one. If they're obviously walking, but if not, if they're on their bed, you would just try for them to push down. And that's basically it. Did I miss anything?
I have a question. I was wondering, whenever you guys are doing your blood pressure and vital signs and everything, do you guys take a moment and write them down or stop in between, or?
I do, but they highly advise you to try to memorize them.
Yeah. I don't know. If you can, but like if you know you're having trouble, you don't want to write down the wrong number after the fact, you know. But
Just have like a piece of paper in your pocket and
Yeah.
just pull it out, write it real quick, and stuff
I mean,
like
I
that.
had it to where if I had the 4 patients, I mean, I had, you know, each room, and then I would morning and afternoon.
There's
Write
like a
down
piece of, there's like a little chart thing that
Oh,
St.
yeah,
Joe's
their-
has.
their
like a
brain.
card thing.
Yeah, it's like
Their
a
brain.
card thing that like you can put vitals for each patient, the different rooms, and those are so helpful. Yeah, they have it in each unit. Like I think a lot of the nurses use it. Like some nurses have like their own system, but most of the nurses use it. It's like probably that big. You could like fold it up, stuff it in your pocket, and pull it out anytime you have like certain information on your patient.
Why are you guys putting gloves on when you check the feet?
hygiene, right?
Yeah.
Yeah.
Question for the perineal area. When you check, do you just check with the light, or are you actually for the females going in there and spreading to see if there's any abnormalities, or how do you guys?
You can check if she has a Foley in. You want to like spread and see like, okay, like is there any like crust like around the cording? Like is there any blood in the urine? You know, coming from the tubing. For that kind of instance, I would spread the labia and check.
But like anything else, you just want to look if there's an odor. Do you see any like discharge coming out? You just want to look at if there is discharge, like what color is it? So
It's good practice because you're going to do that all second semester. It's constant.
And then for like when you're looking at their back, just make sure like there's no ulcers or anything like that. If their sheets are wet, make sure that they're dry. You don't want to like have them, especially the patients that are immobile. You want to keep them dry. You want to keep them, try to turn them every so often. You want to avoid those detritus ulcers.
Oh yeah. Any other questions about head to toe or anything? You guys nervous? You excited? Anxious, excited? Oh.